Rheumatoid arthritis is a chronic autoimmune disorder that primarily affects the joints, leading to inflammation, pain, and potential joint damage. In Nigeria, the prevalence and diagnosis of RA present unique challenges. Rheumatoid arthritis, all it entails, would be the bane of our conversation on healthy living today. Hello and welcome. I am Aisha. Salihu. According to a research by African Journalists Online conducted at the Lagos State University Teaching Hospital revealed that 10.6% of 1,215 patients with rheumatological disorders were diagnosed with RA. While hospital-based studies provide valuable data, they may not fully capture the prevalence of RA in the general population due to underreporting and limited access to healthcare facilities. And now to tell and explain properly what rheumatoid arthritis is, we have Dr. Anipole Olalekan Akeem, who is a consultant orthopedic surgeon of the Department of Orthopedic Surgery, Federal Teaching Hospital, Birnin Kebbi. Thank you so much, Doctor, for joining us on the program.
Thank you very much.
Now, I'd like to start off with you. How would you describe rheumatoid arthritis?
Rheumatoid arthritis is, let me take it one by one. Arthritis actually means from the word arthro and itis. Arthro means joints. Itis means inflammation. And then your inflammation from the word inflame is something associated with fire. And when there is fire in the body, definitely there will be pain, and among other things. So arthritis simply means inflammation of the joints, characterized by pain, swelling, stiffness, and other things. Now, rheumatoid arthritis is one of the example, the commonest type of what we have as a group of disorder, inflammatory joint disorder that we call inflammatory rheumatoid disorders. So it's a disorder of the joints that is characterized by pain, swelling, stiffness, usually morning stiffness or inactivity stiffness. And it's a chronic disorder that also involved all the parts of the system. It's a systemic disorder. It affects all the parts of the body, not only the joints. And the joints, the affection of the joint tend to be symmetrical. What do we mean? If it affects the right leg, in the same way it affects the other side of the leg. It affects the joint, like I said. And then commonest, the fingers or the small joints, then the larger joint. Apart from the joint, it tends to also affect the covering of the tendon and some other parts of the body, organs of the body, especially the heart, in which it can actually subject the heart into what we call ischemic heart disease. Generally, rheumatoid arthritis is a grave disease in which the people that are affected tends to live younger, die younger than the general populace. Thank you.
Okay, doctor, I like the fact that you have broken it down in this very simplistic form, but then I'd like to hear from you. What would you say are the risk factors for this particular disorder? You have stated that it kind of predisposes to another condition. You talked about the heart and other parts of the body, but then what are the risk factors and what would you say are the early signs and symptoms?
Very good. Rheumatoid arthritis. It's a disorder that's the cause is not really known. In general terms, there are genetic predilections with environmental factors. However, the cause is not really known. Studies still going on. There are just theories, but there are no known cause apart from genetic predilections with some environmental exposures. What should actually cause the pathology of this, what is the basis of the pathology or pathogenesis of this rheumatoid arthritis is that there is like the body consists of what we call in a layman soldiers that we call antibodies. These antibodies in the body, they are meant to fight strange substrates or anything strange in the body. Just like in the barracks, if you have stranger that looks like an armed robber or a thief, then he's attracted to the soldiers with their weapons. There's an attack against those strange structures or strange substance with the aim of mopping them up. Now, in this rheumatoid arthritis, what happened is that some antigens just developed, specifically now in the covering of the joints that we call the synovium. The joint has a covering we call a synovium. These antigens present in this synovium, the body realizes them as strangers. And so in a bid to protect the body, it attacks that synovium. Synovium obviously is part of the body, but where the body is now attacking itself, a structure within it, and then that is unfortunate. And so it's like antibody that is fighting against the body. Now, the part of the body we are talking about now is the joints, the covering of the joint, the covering of the tendon. When this antibody fights against this antigen, they form a complex that will not trigger off what we call inflammatory reactions. These inflammatory reactions is a reaction in which the body actually uses to protect itself when there are foreign bodies or when there are diseases or any strange things that want to affect the body adversely. Now, these inflammatory reactions now go on against the body, and in the process it becomes chronic and leads to destruction of this part of the joint that we are talking about, the synovium. The process starts from that synovium, and then from there it forms further complex structures that are injurious to the joints. And then all of this process continue in cascade and leads to the total destruction, partial and total destruction of the joint as the time goes on. Not only the joint affect the tendon, not only that affect the tendon, affect other parts of the body. And then this chronic inflammation, the problem is that it is quite difficult to contain. And this is what eventually leads to the diseases in the body. The joint leads to, apart from destruction of the joint, which is attended with pain, swelling, there's also deformity of the joints. Like the joint of the hand can become deformed, the knee can become deformed. Where the knee or the hip is affected, the patient will not be able to walk. So it affects functions. Where the tendons are affected, it can lead to destruction of the work of the tendon, and so impair movement or walking as it's concerned, the lower limb. Where the heart is affected, it leads to ischemic heart disease, and then when the heart is affected, it can actually lead to the demise of the patient. So this is the cause is not really known, but there is known to be a genetic predilection with exposure to some form of antigen. That is what actually triggers these inflammatory reactions.
Okay, Doctor,
that leads to rheumatoid
when you
arthritis.
talk about the risk factors, that predispose one to this particular disease and how it affects the functionality of the body. But then I'd like to hear from you. This particular disorder, is it more predominant in a particular gender or age group? I just want us to establish that so we know people who are more at risk and who should, be cautious.
Yeah, thank you. In terms of age predilection tends to be common between the young ones, between 30 and 40 age group, and then tends to affect the female more. The reason behind that we don't know, but that is the epidemiological discovery. Tend to affect the Caucasian more than the African people, and then the body parts that are affected tends to affect the smaller joints more than the bigger joints.
Okay, doctor. Now, given your expertise in orthopedic surgery, how do you approach the management of rheumatoid arthritis in patients, especially considering the unique challenges faced in Nigeria?
Thank you. Rheumatoid arthritis can be quite expensive to manage, and then the prognosis is guarded. What do I mean? You cannot actually give assurance of what it's going to be, but the best is to have an early diagnosis of the disorder, and the earlier it is picked, the better. So the aim is that you want to curtail the extent of the inflammatory processes, and so the treatments is first detection and then treatment. And the treatment are categorized as you want to ameliorate the symptoms of inflammation and also mitigate the inflammatory process. So with this, we tend to give what we call anti-inflammatory agents. Common among them is the prednisolone. This prednisolone can also be dangerous, not for every pain, because we tend to see a patient that goes to the chemist who would buy over-the-counter drugs anytime they have body pain, and some of them get to be prescribed to prednisolone, get prednisolone to manage their simple pain, that's paracetamol or some non-inflammatory steroid and non-steroidal anti-inflammatory drugs would have taken care of. So prednisolone, as much as it is good anti-inflammatory agent, also has its side effect, systemic side effect, which we don't want the general populace to involve with. Is quite dangerous if it is not taken under the guidance of the medical doctors. So apart from anti-inflammatory drugs, we also give what we call disease-modifying anti-rheumatoid drugs. Methotrexate, hydroxychloroquine. These are drugs that tend to mitigate the process of rheumatoid arthritis. And then, of course, on the physiotherapy also come in to rest the joints, to position the joint where there is deformity, or to prevent deformity. You want to use some splints for the fingers, for the hands, for the foot. The case may be physiotherapy also. It's actually a multidisciplinary approach in which that include the rheumatologists, which are on the medical side, the orthopedic surgeon, physiotherapy, the occupational surgeons, the nurses. So everybody comes together, one way or the other, to help in the treatment of this.
Okay, doctor, you have talked about this disease, and you have gone far and beyond, but I'd like to pick up your brain on where you talked about the total destruction of the joint. I mean, I'm looking at surgical intervention now. You have clarified drugs intervention. What are the most common joint deformities you encounter in RA patients? And I also like to hear from you, how do you address them surgically?
Thank you very much. In the joints, in the knee joints, patient could present with what we call a bow leg, a knocked knee, which is the reverse of the bow leg. They can come with other form, windswept deformity, in which one of the limb is bowed, the other one is knocked. And they could have also in the fingers, they could have what we call swan neck deformity, bottom-neck deformity. These are common deformities that rheumatoid arthritic patients tend to come down with. And to prevent some of this deformity, like I said, for the fingers, for instance, the physiotherapists or the orthotics or the prosthetists who are the professional in making such splints, they can give the patient these splints to prevent this deformity. Where the deformity occur, especially in the hip, in the knee, or even in the hip, then you can offer what we call arthroplasty, total knee arthroplasty or total hip arthroplasty. There's also ankle arthroplasty, there's shoulder arthroplasty, depending on which joint is affected. The whole joint can be completely replaced.
Okay, doctor, let us quickly go into this. I mean, considering the high prevalence of comorbidities such as hypertension and diabetes among Nigerians, I mean, RA patients, how do you approach comprehensive patient care?
Now, the patient that has rheumatoid arthritis who also have an underlying diabetes mellitus or hypertension, we manage all these conditions on their own by different specialty. The diabetes mellitus is being managed by the endocrine physician. The hypertension is being managed by the cardiologist. And then if the patient has rheumatoid arthritis, the rheumatologists are also there who are the specialists to take care of rheumatoid arthritis. Rheumatoid arthritis is actually not in itself orthopedic condition. Is more of a rheumatological condition. It's a medical condition, but it affects the joints. When it leads to, especially when it leads to the destruction of the joint, that's when the orthopedics comes in to actually do the orthopedic part of the management. But the basic management for the condition is medical. And that's why when we start the treatment is drug, apart from the prevention of the deformity where the physiotherapist or the orthotic and prosthesis comes in. When we get to the late stage, that's when orthopedics actually come. That does not mean that we don't see the patient with rheumatoid arthritis even at the early stage, but we co-manage with the rheumatologist where the medical therapy actually comes in.
Okay, doctor. Now let us look at the basic management techniques, just like you have stated earlier. I mean, what strategies do you employ to address the knowledge gap among primary care physicians regarding early detection and management of rheumatoid arthritis in Nigeria?
Now, we need advocates. We need to actually sensitize the public, and then that will bring the importance of what we are doing presently to get the public aware. And what public needs to know to be able to pick up like I said, early detection is very important. The symptoms of rheumatoid arthritis, when you're having a patient that is complaining of multiple joints pain, usually in the middle age group or young age group, like between 30 and 40 years of age, and they're complaining of multiple joint pain, like I said, multiple. The joint seems to be symmetrical. If it's affecting the finger, the particular finger on the left, likely to be the particular finger on the same side, on the other side of the finger, and it tends to be symmetrical. And you're having such pain, more than 2 joints. Patient is also having some maybe stiffness of the joints. Patient is having, apart from the pain, swelling, stiffness of more than 2 joints. In a young patient like that, we may also have some other things like rashes in the body, which is also giving rise to other form of inflammatory arthritis. If you're having all of this, it is very important that such a patient present to hospital as soon as possible, so that the disease process can actually be addressed at the early stage.
Okay, doctor, you talked about how awareness is key in the management of this particular disease, and you've also talked about the primary care and all of that. But then let us look at, we're looking at it in the rural center now. How do cultural perceptions and awareness of rheumatoid arthritis in Nigeria influence patients' outcomes, and what measures can improve public understanding?
We will need enlightenment program. Rheumatoid arthritis, fortunately, is not quite a very common disease. Usually in the rural area, it tends to be disease in the more developed states. However, in Nigeria, we have been seeing quite a number of them. Maybe due to lifestyle modification changes, but in the rural area, it's not as common as it is in the developed states. However, it is still important to take the awareness to such places, and the means in which we can get them involved is through the community-based medicine. We can get it through the primary health center. We can get to have a sensitization program at the primary health care level to educate the people at the rural area, give them the signs and the symptoms that could be seen in patients that have suspected rheumatoid arthritis, and then give the link for referral to a more tertiary institution where these diseases are being managed. And of course, it won't be also out of place to have community mobilizers who can also work in such areas to help in early detection of such a patient and early referral. Thank you.
Very rightly said, Doctor. I guess all of that measure would help curb the cultural perceptions that people may have, especially in the rural areas, about this particular disease. Now, I'd like to hear from you. I mean, in your experience, what are the primary barriers to accessing advanced RA treatments in Nigeria, and how can the healthcare system overcome them?
Yeah, thank you very much. Like I told you that the management can be cost demanding. Patient will have to be on drugs. And with the fact that rheumatoid arthritis does not have a cure, you only manage it, cannot say it has a cure. So patient will have to be on one form of treatment or the other for life. So it's actually fund demanding. And the challenge we have in this country, in which most of our patients, they are paying for their medication, that can be quite challenging, especially when it gets to the end stage where there is destruction of the joint and patient will need arthroplasty. Total knee arthroplasty, total hip arthroplasty for now will be ranging at around the range of 3 million thereabouts, depending on the facility, and which will not be something that will be affordable by an average Nigerian.
Okay, Doctor. Earlier you talked about the management strategies, where you talked about it in, in steps and differently. But then let us look at the synergy and how how do you balance the use of pharmacological treatments with non-pharmacological interventions in your management of RA patients?
Yeah, in the management of rheumatoid arthritis, the non-pharmacological, the pharmacological, and surgical, all of these have to come in place depending on the stage of the disease. Like I said, a patient with rheumatoid arthritis, the first thing, it also depends on the stage. The first stage is the preclinical stage, in which patients manifest with pain, come down with pain, swelling, and then at this stage, it will the rheumatologist will come in and then give patient with benefits with from what I call the anti-inflammatory drugs and the analgesics. This one we have to take care of the disease modifiers like methotrexate, hydrochloroquine. All of this will help in ameliorating the process of inflammation. And then the non-pharmacological aspect of it, like the use of brace, because the rheumatoid arthritis tends to destroy the structures of the joints and leading to deformity. And to prevent this, because it's likely going to happen, especially if it affects small joints like the joint of the fingers. So to prevent this deformity from arising, braces by the physiotherapist, by the orthotics, may have to be given to the patient to prevent the deformity. And then, of course, the place of physiotherapy also come in. They may want to use ice therapy, want to use some other form of electrotherapy to also take care of the pain. And of course, physiotherapy also offer exercises which could also help in preventing progression of the disease and symptomatic management. And then the surgery comes in at the end stage.
Okay,
like
Doctor,
I said earlier.
basically saying that the treatment or management of this particular disease involves a multifaceted approach. I mean, where we have a lot of people coming in to put in their input regarding on the stage the patient presents with the disease and the kind of care that has to be given to the patient. Okay, Doctor, just before we let you go, I'd like to hear from you very briefly. What role does patient education also play in the management of RA, and how do you ensure patients adhere to treatment plans?
Thank you very much. It is very important. Education is very important in patient care. because with education we'll be able to deal with the cultural belief systems that actually be empowering the state of health of our patients, generally speaking, generally. So the place of education is very important. Patient that has rheumatoid arthritis, not just to be giving drugs, we have to educate the patient. You need to prepare the patient's psychology. You need to let the patient know or what we call the prognosis. The prognosis. You don't need to hide the information to the patient, because you help the patient to psychologically prepare his mind and also knows the journey ahead of him, and it will also help the patient to be part of the treatment. And where the patient put himself part of the treatment, it actually it brings a good outcome for the patient.
Thank you so much. We have been speaking with Dr. Anipole Olalekan, who is a consultant orthopedic surgeon at the Department of Orthopedic Surgery, Federal Teaching Hospital, Birnin Kebbi, and he has been giving us, all rheumatoid arthritis entails. Thank you so much for your insights and input on this particular episode of Healthy Living on Trust TV. And on that note, addressing the challenges of RA in Nigeria requires a multifaceted approach, including public awareness campaigns, training for healthcare providers, and improving access to healthcare services, especially in rural areas. Early detection and appropriate management are crucial to prevent disability and improve the quality of life for individuals affected by rheumatoid arthritis. That concludes this week's episode of the program, Healthy Living on Trust TV. Remember to stay hydrated, stay safe, and stay moisturized. For comments, contributions, and suggestions, do well to follow and subscribe to all Trust TV social media handles. Download the Trust TV app on iOS and Android devices across their respective stores and get live updates on the YouTube live stream and the website. I am Aisha, Salihu. Thank you so much for your time, and we will be leaving you with some facts on rheumatoid arthritis.